Hi guys, this is Mitchell for Project Fmile. Now, Project Fmile is a project that was started with an aim of spreading awareness on mental health and suicide here in Kenya. First things first, sadly there has been an outbreak of COVID-19, which is novel coronavirus 2019, which is a strain of SARS-CoV-2. Right, I think that's a specific virus, but I'm not a medic. So yeah, there has been a lot of panic amongst ourselves, especially those who are immunocompromised, so those with chronic illnesses or drugs that actually affect their immunity. So for those guys with issues with their immunity, I would advise for you guys to stay safe, and to everyone in general, stay safe, avoid crowded places, avoid misinformation, as there's a lot of misinformation online and on the internet. So basically rely on your government or press releases from the government, WHO, World Health Organization, and CDC, Center for Disease Control, for your information. Now, since we're talking about information, I'd like to tell you about CRAM. So the CRAM is I would like to call it a news outlet, but it's not really a news outlet. They provide us with our daily cup of the crumb. That's what I call it. Every day I need a daily cup of the crumb. So the crumb basically gives us what's what in our generation and news on different issues, from political issues to social issues, from the US to South America, to Africa, to Asia, and all that. And I find that so amazing. This is not a paid sponsorship. It's just I feel like you guys should subscribe to the Crumb. So you can head over to their website, www.thecrumb.com, and you can sign up for their newsletter. So you can get it via email. Email, it's absolutely free. If you decide you want your Crumb via text message, it is about $9.99 USD. 9.99, which is 10 USD per year, which is really affordable considering you're paying for 365 days or 366 days a year. So you do the math, 366 days divided by 9.99 USD. It's really affordable actually. So I would advise you guys to get whatever works for you, be it via text, via email, or via Instagram. They actually do IGTV videos on Instagram, so follow them at the Cram. Spelling is CRAMM. So I find the IGTV videos very convenient for me, as I can listen to them as I'm doing something else. So yeah, you guys check it out. I think it's important for us to always have information. Ignorance is no longer an excuse. So yeah, that's all I had to plug. Also follow us on our social media accounts at Project Fmile on Instagram, Twitter, and Snapchat. Yeah, we do have a Snapchat right now. Anyway, so I also follow Humans Against Sexual Violence. A video about that is coming out soon. So moving on to today's topic, we're talking about a mental illness. It's been a while since we did talk about a mental illness. I feel like the last time we did such a video, we were talking about bipolar. So today we're talking about mental illness. So the specific mental illness that we're going to talk about is like the most common mental illness, like the one mental illness everyone knows, and that's depression. And the thing is, I feel like depression has this negative connotation to it because of how it's been portrayed. It's this attention-seeking kind of mental illness, and it's been extremely romanticized, and everyone thinks it's really trendy for some strange reason, which is it's not. So I feel like that's why we wanted to do a video educating people on what depression is and what depression looks like. Secondly, apart from us having this negative connotation, we just think of this sad suicidal girl and all that, and we don't pay much attention to it. And again, we fail to realize that there are different types of depression. There's major depression, which is also clinical depression. We also have postpartum depression and bipolar, because it has its lows and its ups and its lows. It's mania and depressive seasons. So I believe you should check out the video when we talked about bipolar. So I will link it down in the description. So I feel like the first thing we're going to start with, we're doing it in the style of a question and answer. So the first question is, what is clinical depression? Now, clinical depression is defined as the persistent feeling of sadness and loss of interest that characterizes major depression, can lead to a range of behavioral and physical symptoms. This may include changes in sleep, appetite, level of concentration, daily behavior, or self-esteem. Depression can also be associated with thoughts of suicide. So I feel like from that definition, we do have an idea of what clinical depression looks like and some of its symptoms, but we'll still go ahead to talk about some of its symptoms. So what are the symptoms of clinical depression? So some of the symptoms of clinical depression include that you feel sad or irritable most of the day, nearly every day. You are less interested in most activities you once enjoyed. You suddenly lose or gain weight or have a change in appetite. I feel with this, I would put a star in it or an asterisk on it, because again, we also have eating disorders. We do have a video where we talked about eating disorders, so we really need to like draw the line of where this could be a sign of depression or this could be a sign of eating disorders. You have trouble falling asleep or want to sleep more than usual. You experience feelings of restlessness. You feel unusually tired and have a lack of energy. You feel worthless or guilty, often about things that wouldn't normally make you feel that way. You have difficulty concentrating, thinking, or making decisions. You think about harming yourself or committing suicide. So again, noting this one, I feel like we also need to realize that not all the times are suicidal thoughts a sign of this depression, but they can be no, not all the yes, I actually meant what I said. So yes, self-harm, we have a video on self-harm, and we also have a video talking about suicide, so I would also suggest you check them out. So I have, okay, there's also unexplained physical problems such as back pain or headaches. There's also anxiety, agitation, or restlessness, slowed thinking, speaking, or body movement. So those are some of the symptoms of depression. So what are the statistics on major depression? Because for us to understand its magnitude, we have to look at the statistics. Whoa. There are more than 264 million people affected by major depression, according to WHO, World Health Organization. The thing is, I feel like it's actually the most common mental illness, and we need to raise more awareness on depression for people to understand what depression looks like. And the thing is, also in the day and age we're living in, we don't know how to differentiate between sadness and depression, and that's a bit annoying, especially in the fact that us having the internet, it's a good thing because we get to spread information on different things, but that means we also have these people who self-diagnose, and I have an issue with self-diagnosis as it creates and taints this bad image on mental health. For example, the whole Trisha Paytas thing of her self-diagnosing herself with dissociative identity disorder. For those with DID, it feels tainting in a way because it destroys the community and what the community is working hard for, and that is awareness. All we want as mental health activists is awareness on these mental disorders. So sadness is a normal human emotion that every single person will experience at stressful or somber moments. I feel like all of us have been sad at one point or another. It's completely normal, be it because you've lost a job, or you've lost a significant other, you have financial trouble, loss of job, I've said that, yeah. Absence of a loved one, financial trouble, failing an exam. I happen to feel really, really sad when I fail an exam, not getting a job, or experiencing other disappointing events can also just trigger sadness. However, a person experiencing sadness can usually find some relief from crying, venting, or talking out frustrations, or more often than not, sadness has links to a specific trigger. That is very important to note. I feel like the one thing that distincts depression from sadness is that sadness has a specific trigger. So, for example, let me think of the last time I was actually sad. Maybe let's just say failing an exam, or I didn't do as well in a test. I was sad about it, and I felt better once I just vented it out. I was like, I worked hard, I didn't get the marks I wanted, point blank period. So when you talk about what is causing you to feel this way, you end up just relieving yourself. So yeah, sadness usually passes with time. If it does not pass, or if the person becomes unable to resume normal function, this could be a sign of depression. If low mood gets worse or lasts longer than 2 weeks, the person should talk to their doctor. So again, we have talked about sadness and depression. Okay, we've specifically talked about sadness right now. So we've seen like what sadness is. Sadness is something I feel like every human can see they've experienced. You have lost a loved one, you have lost a job, you failed to get an opportunity. We've all felt sad at one point or another. So again, it doesn't mean that we should dismiss the fact that when you're low for like 2 weeks straight and just be like, it's sadness. No, that's the issue, because again, with the generation that we live in, we can be really dismissive. We'll feel like, that's just sadness, like, especially this thing of like, oh yeah, that's just the typical 14-year-old who's really into Billie Eilish and thinks they have depression. I feel like it's really dismissive in the sense that we don't get to hear this person out, and we just feel because they listen to Billie Eilish and put the sad songs and sad quotes on their Instagram stories, they are faking depression. I feel like we need to actually get them help, because we don't know what's really going on. This is could actually be a cry of help. So yeah, for help rather. Then moving on to what depression is, we were still distinguishing two. Depression is a mental disorder that has an overpowering effect on many parts of a person's life. It can occur in people of any gender or age and alters behaviors and attitudes. In 2015, 16.1 million people aged 18 years or above in the United States had experienced at least one major depressive episode in the last year, accounting for 6.7% of all adults in the country. So we can see the magnitude in depression. We can see why it is important for us to actually raise awareness on depression. We can see why it's important for us to also distinguish between depression and sadness. So the next question is, like, I feel like every person of older generations, older than millennials or Gen Zs, always ask is, how come like people are so depressed nowadays? That's that question actually really vexes me, because I feel like in the day and age we live in, there's more awareness and there's also more chances for people to seek help. So that's why we're seeing a rise in the number of cases of depression. That's what I feel. I feel like people have also dismissed depression, that it's a first world problem, and that we shouldn't be experiencing this, especially for Africans. It's a first world problem, not for us. But the thing is, even if we were to like term it as that, I don't think someone simply being rich shields them from problems. It does not shield anyone from problems. Being poor does not also shield you from problems. Shield you from mental health problems. Yeah, shield you from mental health problems. For example, if you are poor, if you are poor right now, you're probably stressed about where you're getting your next meal. You're probably stressed about how you're going to provide for your children, where you're going to get shelter from, where you're going to get your clothes from. So I don't feel money shields anyone from mental disorders. So I feel like the major reason why we view depression as so common nowadays is because there is more statistics on that as compared to our previous years. Now, what are the causes of depression? So I feel like for us to understand depression, we have to delve deep into what causes depression. Now, depression is not one of those diseases where we can say, you're the one, you're the one that causes it. We don't have that specific one thing that we could pinpoint and say, yeah, you're the cause. So some of the causes could be physical illnesses. Physical illnesses such as cancer are tied to higher statistics of patients having cancer. People with chronic illnesses such as sickle cell anemia or epilepsy or asthma are more likely to have depression. Gender, so for gender, depression occurs more commonly in females than in males, and that's because women internalize stress more than men. Stress, that's the next cause of depression. So long exposures to stress does lead to depression. The aging brain, so this I remember got me confused. So with the aging brain, I don't want to spread misinformation, but it does have to deal with the fact that your brain structure does change over time. So with the brain structure changing over time, it means that how things used to work is no longer how they work, in the sense of neurotransmitters and the level of serotonin and dopamine and all that. I hope you get the gist. Genetic factors, again, if there are people in your family who have depression, you're more predisposed to having depression. Biochemical factors, again, I think I have just talked about the hormones that deal with all this, so yeah. And also personality. So personality, I would explain it in the sense of someone who's shy or someone who is who has low self-esteem is more likely to develop depression compared to someone who's not shy or who does not have low self-esteem. So the last question on our list is, what are the treatment options available for depression? So yeah, there are a range of treatments available for people with depression. Some of them include cognitive behavioral therapy, psychotherapy. So all these are types of therapies. There are people who have treatments on based on medication, so antidepressants, antipsychotics. I have had people saying that they've not had a good experience with antidepressants. So if you are on antidepressants, please tell us your thoughts in the comment section, like what treatment option has helped you in terms of depression. And then the last type of treatment here is that there's also electroconvulsive therapy. So with electroconvulsive therapy, basically electrical signals are sent to the brain and a seizure occurs, which I'm sorry, I'm not a physician, but yeah, that's what electroconvulsive therapy involved. So I hope you are more educated on what depression is. If you feel that you could possibly be suffering from depression, I would advise you to see your doctor or your general physician. If that's not possible, you could take a quiz on Psych Central. Again, it is not supposed to be substituted with the diagnosis of a doctor to just give you a clue, could it be depression? And if your scores are high for depression, I would urge you to see a doctor as soon as possible. So yeah, thank you so much for watching this video. Make sure you like, share, subscribe, tell a friend to tell a friend about us. We are hoping to hit 10,000 subscribers by the end of this year. What else? Yeah, so follow us on Instagram at Project Fmile, on Twitter at Project Fmile, on Snapchat at Project Fmile. Also follow us at Humans Against Sexual Violence. Thank you so much.